We see the fire sticks begin to ignite underneath Rambal Swami. The audience, including our production crew, are in awe. They are excited and anxious to see what will happen next. We see the fire sticks begin to ignite.
So now Dr. Nikunj is coming. Close. So we are again happy that on a single day, 4 generations is together from Christian Medical College Hospital. And Dr. Nikunj is coming and is giving a talk. Because of Dr. IP, a lot of things, his schedule is very difficult schedule. And so we are happy. Dr. IP mentored Dr. Lakshminath. Dr. Lakshminath mentored Nikunj. And I am the 4th in the generation. I said, I am the most luckiest person. I got the legacy of the 4 people, the grandfather, the father, the grandson, and the great-grandson. So in a very sense, you can say Dr. Nikunj is like my father. His father is Dr. Lakshminath, and his father is Dr. I.P. Cherian. So in a single conference, it was a workshop, just with the small initiative of Dr. Nikunj, it became a conference. And we have a number of talks in neurosurgery. We started with just recovery, but we entered the paradigm shift. Dr. Venugopal has given, Dr. E. Gopal will give, I don't know. I never dreamt that a small conversation in the party of Karan can lead such a beautiful thing. And that's the best part of Dr. Nikunj. He says there is nothing called no in the world. I always say in him one beautiful thing. Dr. Nikunj says, Shastriji, he always calls me Swamiji. Swamiji, there is nothing called no. There is always yes. You see, I wasted it 1 hour, but then he made up his 1 hour and he came for the talk. You just hear his words. I tell you, it's another parables of Bible. He has done most wonderful surgeries, down-to-earth person. And when I was in Karat, whenever I go to this conference, you see this scrub now? I did not have money. And this scrub was financed by Dr. Nikunj. And I still wear it wherever I go. And I always say, this is the love of my brother. People ask me, Shastriji, how can you teach 72 hours without sleep? I say, because I wear the cloth of my brother. The love of my brother inspires me to work for 72 hours. And there is Dr. Nikunj, a person, a visionary I ever met in my life. So over to you all, Nikunj, and very warm welcome. And you are going to speak to more than 5,000 physicians by evening. Your video will be telecasted all around the world, Philippines, France, Germany, UK, Nigeria, Zimbabwe. And I'm very happy that in a single day, 4 generations are together in one space in a small room of Gurgaon. Never possible, never impossible. And you always said, I am possible. Over to you, Dr. Nikunj. Dr. Nikunj, sir. Sir, your mic is on mute, sir.
Yeah, I'm now. Yes. Thank you, Swamiji. Just good afternoon to everybody. It's a great platform given to me by Swamiji to talk to you all the guys. Just give me 1 minute. I will be in my cabin in just 1 minute. We will be online. Just give me 1 minute. I'll be in the cabin and then I can talk to everyone. Just give me 1 minute. कितने पेशेंट है अभी होल्ड करना
how things
yes so it was this is a great platform given to me by Dr. Swamiji to talk to you all the people doing good job society trying to help people and educate who cannot reach to the higher doctors or super specialty. So it's a great initiative by Swamiji, which would again I would like to say thanks and a great initiative by our Swamiji to help people and all you guys physicians. I'll give you a small introduction of myself. I'm Dr. Nikunj Mittal and I'm a senior consultant in Greater Noida. Obviously, I have done my fellowships in vascular neurosurgery and spine endoscopy, and I have been trained by a very great, innovative, and a very ground to earth, nice, very ground to earth, and very genuine neurosurgeon, Dr. Ike Cherian. I have been his student for 20 years now. I cherish him. I always look upon to him, and I follow his footsteps and principles while practicing neurosurgery. He always says, when you treat a patient, treat as if he is your own relative. And if you are always on that path or you always follow this principle, the treatment will be very, very nice and it will be correct and accurate. So my topic today or the purpose of visit here is the talk on epilepsy. Epilepsy अगर बात करें तो एक लोगों के अंदर एक भ्रम है. It is a myth inside people that epilepsy is a big disease. It cannot be cured. Epilepsy is a big problem. No, it is not like that. See, epilepsy is a symptom. Like we have infection. Infection symptom is fever. So it is not that fever we cannot treat. We have to find the problem, why the fever is coming, and then give the treatment, which is simple dolo, paracetamol. So similarly, epilepsy is also like that. Epilepsy is a symptom of a problem in the brain, which we have to find out. And the solution is very simple, give medications for that. Now, people get afraid of epilepsy saying it cannot be cured or it takes very long time. Or the people says epilepsy needs surgery. No, it is not like that every time. Epilepsy can be treated, very well treated with medications, with drugs, but you need to evaluate why the patient is having seizures or fits or epilepsy. Once you have the cause or once you know what is the main reason behind it, then you can treat it very well. Epilepsy, if you treat very well, you keep the patient in follow-ups, you keep in touch with your neurologist or neurosurgeon, then the patients have very good outcome. They get they can live their normal life, they can do their normal daily activities, and with slight modulation or changes in the drugs, they can go to school, they can do their office work, they can drive, they can live very, very normal life which everyone, all of us lead. Now, only question arises when to do surgery for epilepsy. Surgery for epilepsy is not very difficult, first of all, I would say, and it is not very dangerous in common language. We have Dr. Aib Cherian sir, who is specialized in doing this epilepsy surgery, and art of the center is there in Karad, Krishna Institute of Medical Sciences in Karad, where Dr. Aib Cherian sir is practicing. And I take my words, it is the best center for surgeries, especially epilepsy surgeries, because art of the facilities are available there, all the instruments, all the facilities, and very nice surgeon, experience and tailor-made approach for each patient. It is there. So epilepsy surgery these days is very safe. You can perform them and the results are very good. The aim of the surgery is usually to decrease the medications and to make the patient free from medications. This is the main aim of epilepsy surgery. But the patients or the selection criteria is very less. There are only few patients who require epilepsy surgery, for which a surgeon, a neurosurgeon has to select and then take a decision. But in my practice of 15 years, I have found that epilepsy can easily be treated with medications. And this, everybody, all of us as doctors, neurophysicians, neurosurgeons, general physicians have to keep in mind and translate the same information to the patient. Yes, they can be treated with medications, nothing to get afraid. You have to generate confidence in the patient. Yes, it is a small problem, it can be treated. And you have to just take few days, maybe the physicians, the physicians or the neurophysicians, just a help of a neurosurgeon or neurophysician to start with. Then it is very easy to put the patient on maintenance dose and then continue, and then to while stopping also, you have to just consult the physician or a neurosurgeon once, and you can, the patient gets treated very well. Now, again, another myth regarding epilepsy is that it gets treated by itself. No, it can never be get treated itself. It will only lead to the problems. Each seizure attack, whenever a patient gets a seizure or fits, it destroys millions of neurons in the brain. The neurons of the brain are the main generating, which are everything to the brain and human body. So please understand, each episode of fit causes damage to multiple neurons which cannot come back. So always aim has to be good medications, and we have to make sure that the patient doesn't get any seizures or fits. Second, and the last myth about the seizures or epilepsy, about which every general patient or the local physician thinks that epilepsy needs long treatment. No, it is not like that. These protocols has changed. There's a lot of new medications have come, new methods are coming, where even the patient doesn't have to be on medications for a very long time. The medications are these days very good, very compliable, don't have much side effects, and the results are very good, very compliable. Only you have to start and see which medication patient is getting fitted to. Now, regarding the surgery part of the epilepsy, again, as I said previously, that it is a tailor-made approach for few patients who are not getting benefited from medications. Secondly, whether it will benefit or not, and the doubt of benefit has to be given to both neurologist and the neurosurgeon So epilepsy is treatable, what I would say. In the last, I would say that the epilepsy is treatable, it's completely curable both with medicines and with surgery. Swamiji, hand over to you.
Sir, we'll also like to be enlightened with your legendary work, what you have done in Gurgaon and other places. Please throw some light on different types of surgeries you perform. And people are always having a myth. Once a neurosurgery is performed, patient will remain paralyzed. I will like to say you how safely you have performed surgeries, both brain and spine. You have performed, in my association with you, I have seen in 6 years, you have done wonderful surgeries, wonderful outcome. And that's what I will like to request you. So please bless these young people to remove this myth that spine surgery or brain surgery is like a traditional concept. Please put the new concept of surgery. Today you do surgery and tomorrow you can take the patient home. So sir, please put some light.
Yeah. See, the myth of paralysis is wrong. Now, the neurosurgery has advanced a lot. The risk of paralysis or damage to the hands and legs have reduced quite significantly now. The surgical risk patient to have paralysis of hands and legs is reduced to roughly around 1 to 2% only. Previous days, before these new techniques and advancement was not there, the risks were high. The surgery used to be very stressful, complicated, and a lot of problems used to arise. But now, as the techniques have gone up, the advances in neurosurgery has gone quite a high. We have good techniques, good instruments. The complication rate has severely come down from initially, which was used to be 30 to 40%, now to 5 to 10% only. And in that also, the paralysis of hands and leg has come down to almost significantly very less. Now, people have a great fear in spine surgery that if we get a spine surgery done, we will get the paralysis of the legs, especially in local remote areas where people suffer from everyday problems of leg pain, back pain, not able to carry out their everyday life activity, taking medicines, painkiller. Please don't do this. It is easily correctable with small surgeries. We don't have to undergo under even general anesthesia. In local anesthesia, there are multiple things which patients can be treated with medicines, with blocks, with surgeries which are endoscopic, spine surgeries where there is no much incision and you get good results. I would all say to you from my experience that our patients we operate on spine, they all do very well. Those patients who come with no power in the legs, they cannot walk, cannot even lift their legs. After surgery, they are lifting their legs, they are able to walk with support, they are able to do their normal lifestyle. At least they are not dependent on anybody. They do their daily activities themselves. Spine surgery have advanced quite a lot. Initially, there used to be long incisions, long surgery, and the result used to be not so great. Now, the results are very great. Surgery time has come down, and we use new instruments, new techniques, which have reduced the complication, I would say, to 1%. And even now, we say 1%, but technically speaking, on ground, the real ground, the complication rates are very, very less. So, please spread this message among your patients that spine surgery is not harmful or it is not dangerous. It is very, very safe surgery. You get good results. Only the patient has to be a bit patient, calm, and he has to show confidence in his surgeon. Then the results will be so good that the patient himself will say, sir, that was the best decision of my life. The spine problem doesn't need these big. These days there is so many blocks. Patients who keep on having sciatica or back pain, they keep on taking medicines. For this have come up like blocks. We give injections in the back and the patients get complete relief, immediate on table, and their requirement of medications goes down very significantly. They don't require any medicines, and with that one block, they live life happily for years. And sometimes it reoccurs, so we can give another block which is harmless with no complication rate. We are specialized in giving such block injections in the back for the sciatica, back pain, for which patients have been taking medications for very long, which they don't require after taking the block. Then physiotherapy. After block or surgery, the physiotherapy plays the main role. The Swamiji, who provides excellent and the specialized therapy, physiotherapies for all these patients, it makes them work in their normal way. They live their life in a very, very normal way. They do good job. They come to their life back to normal, who are bedridden, couldn't do anything. They come to their life. It just takes some time, some energy, some willpower, and some support. And take my words, it works miraculously. All these patients do very well, but you have to be calm down, show some confidence in the physiotherapist and the doctor. After surgery, some physiotherapy, and patients do very well.
Dr. Nikonj, I'll also thank you for one more thing, for your good initiative that we are going. You will be happy to know I am going for a world tour, taking your message around the world. But we are having a MOU with many universities. Now, you have given a very good suggestion that all these physiotherapists who are coming in touch with you and you are working jointly with the patients, you will help them to publish the paper. Please put some light on that, that how their unity with us can give them a international exposure, because going to an international university, you need a lot of money. But if you have publications, you don't need money. You get money from the scholarships. So, sir, you have put up idea that you will help them to publish the papers, and we can work jointly for a good purpose, good solve, and they can get an international exposure of international subjects. So please put a light on that.
Correctly said by Swamiji that paper publications is a great way to get a lot of patients, to get fame, and put in the world that you are doing good job, you are doing good, great work, so that we can help very well. You guys can come to us. We will help you in putting a publication. Publication helps you in multiple ways. It increases your confidence. It puts you in front of the world where people read about your work and they acknowledge you and they give respect and they show more confidence in you in sending more patients. Secondly, when you have a lot of publications, people worldwide, I'm not talking about India, I'm talking about the world, where people recognize your work, respect, give you more focus on your work, and call you to teach in their country the same thing. So the publications help in these ways. And I can assure you that we will be able to help you to produce more papers, publications with work, what we can do or what we are doing, and helping you to get into the publications writing, write it down, put your name and produce and show to the world. Yes, you can do it. See, the publication is a big platform, but you need a slight support, and we are ready to help all you guys out there to support in terms of publication, because it needs a bit of technical terms, a technical production, and where to put, where more and more people get connected and give authenticity to your work. So yes, as said by Swamiji sir, that we can help you in that. Get in touch with us. We can help you. Each patient, please remember, there is nothing called I cannot do it. You can do it. Each patient is a potential patient to produce one single paper. Only thing is you have to think how to do it. I can assure you that I have each patient every day, each patient what I see in OPD, or I operate every day. Everybody can be operated, everybody can be, we can write a paper on each patient, because every patient is a different patient. There is something different in each patient to learn to publish. But I am a lazy man, so I need somebody, my students, my fellows, my physician fellows, friends, who can write down, which I will help them. See, I'm always surrounded by a lot of OPD patients, lot of OTs. So I usually don't get time. So I just usually wash off my hands by running away. But I can always help you. I am still each day what I operate. Each patient is a different patient. Each patient you can publish something. You can put it to the world. Okay, this is different. This is we have done new. This is OPD patient. This we have done new treatment. We have tried something new, and you can publish. There is not a need that you should publish 100 patients, 50 patients. You can publish case reports. These days, people find case reports because everybody has some specific query or some specific type of patient, and this search case report, is there any patient on Google, is there any patient something with this, like this symptoms? So case reports are easily publishable. Easily you guys can publish it, and even the good journals take it very easily. They don't travel or they don't put many uh, you know uh, difference in your work. So I can assure you get associated with us. We can help you, or I can help you to write lot of papers, publish in as a case report or publications when you have a lot of series of patients, and that will help you in your career to grow forward. Because when you want to take a leap, it is these publication papers only which help you to take a leap in the career. It takes your career to next level. Where you are, you will be next level, which will help you to these publications.
Right. Sir, finally, we request you for your visiting card so that people can push to your chamber with patients and papers.
I will soon, I will be soon giving it to you, Swamiji. I don't usually carry one, and I don't usually have one. So soon, something like that, I will be giving to you so that the people and the people around, doctors, physician, physiotherapists around us can connect to us very fast and get a help. For the timing, what we can do is my number is there 95 850 33341, where people can connect to me on my WhatsApp, and I usually respond to all of them, and then slowly we can connect to each one to their custom need. People, physicians out there, the physiotherapists, or the patients who are in trouble, who they need some help or who need advice, what to do, is there any hope, or can we do something, or something can be done for their specific needs. I am always there for their help.
Now, finally, you give a small talk on your work in Sarda University. Final, sir. Sir, it's too demanding, but when you are speaking, I have the right as a younger brother to demand. So, sir, something on your work in Sarda University and Noida.
Okay. I am working as a head of the department in Sharda University. It's a it's a medical college for helping the patients who can't afford very high treatment. It's a specialized 600 bedded hospital where good facilities of the neurosciences department is there. We have a team of neurosurgeons, or 4 neurosurgeons. We have 2 neurologists. We have a fully equipped neuro OT. We have all the instruments required for neuro department or investigations to conduct. We have recently opened a new hospital in the same campus where a 3 Tesla new MRI machine and a latest CT machine has been installed, which can do scans in only 0.35 seconds. So patient doesn't have to be in the MRI room for very long, or for the CT scan. They don't have to wait for very long. CT scan, the latest CT scan, which can do 0.35 second, and the MRI, which can do the MRI of the patients as fast as 10 to 15 minutes, which usually take 45 minutes. The hospital is very good. We do all the complex surgeries of the spine, brain every day, and we have good category of patients, all the facilities available for all kind of people who want to come and get our services. It is not necessarily the patient has to have a money. We even do free of service to the patients of neurosciences department for their benefit. We have a special quota called BPL category, where patients get admitted under a proper quota, and then they don't have to pay much except for some medications and some surgical charges, which is very less as compared to any other neurosurgical or neurosciences facility available in any of the places. So I am very proudly say that I am a doctor or a consultant associated with Sharda University in Sharda Hospital, where We give good treatment, world-class treatment to our patients with all the facilities and with all the amenities.
And finally, one thing I like to say in Urdu, हम तो चले थे आपके साथ जाने में काबिल, पता नहीं कब आप जुड़ गए, कब काढ़ा हुआ बन गया, कब विचार बदल गए, कब सर्जरी बदल गई, कब लोग बिस्तर पे आए और कब चल पड़े, सूरज उदय हो गया। अब चुरस्ता बाकी है, पुलिस्ता खिलना वाला है। अब भारत की नई उमंग आई है, अब नई डगर आई है, अब नई नई जहां आया है। अब ये नए बच्चे नए तौर से अब इस नई डगर पर चलेंगे। आज फिर वही बात बोलने का मन करता है सर, आओ सब कदम मिलाकर चलना होगा, मान अपमान सम्मान अभिमान से ऊपर उठकर जीना होगा, जन जन तक पहुंचना होगा, जनता को अब जनार्दन बनाना होगा, पीछे बुलाकर संदीप पर अब जोर देना होगा और कदम मिलाकर चलना होगा, कदम मिलाकर चलना होगा। Sir, you are really great, a great brother, a great mentor, and I always like to say one thing, always people tease me in my personal life, Sastriji, you are an orphan. I always say, till my brother is alive, don't worry, you don't have to come to my, people make my fun, my family members make my fun. They say, Sastriji, हम मर जाएगा तो आपको कंधा कौन देगा? I always say, निकुंज आ जाएगा, don't worry. And people think me and Nikunj
Nikunj is always there. Swamiji, Dr. Nikunj is always there.
Nikunj is always said, Nikunj is the brother of Sastri. And people get confused. Who is elder and who is younger? I say, Nikunj is younger, elder, I am the younger brother. And I'm very happy, the whole family from Christian Medical College Hospital, Malhotra, from Lakshmi Nath, IB Cherian, Nikunj, and me has fortunately become the member of the family, adopted son of the alumni, has come up with a new paradigm shift where a good surgery is performed, good recovery is done. We see these people on the wheelchair and we don't want to see them anymore in wheelchair. And we know that in a shorter period of time, Dr. Nikunj will take an initiative of establishing a very good rehab unit, a very good centers of excellence in Noida where people can recover, where we will see faster recovery, greater recovery, surgery and recovery at the same speed. And the patient comes on wheelchair and he goes running from there. This is our vision. May God get us the blessings of Dr. Nikunj in long run. May this younger physiotherapist who are working in the whale can swim with the ocean. When the ship is on the ocean, you don't fear with the waves. Nikunj is that ship, I tell you, you can rely on him, you have confidence on him. And I tell you, this is a Titan. It's not a sinking Titanic. It's a beautiful Titanic of 21st century. It will not sink you. It will take you to the most beautiful shores and exploring the most beautiful part of the brain and spine. Whenever you go to him, he will always say, come to the OT, I'll show you how beautiful is spine surgery. Whenever I went to him, I said, sir, ab kya hoga? Arey kuch nahi hoga. Kal chala dega isko. I said, sir, possible? बिल्कुल possible है शास्त्री जी. No बोल के तो मैं जानता ही नहीं. And from that no, you see, a small workshop was converted to a conference. I never thought so many talks in the same day can be performed. IB sir has given, you have given, Lakshmi has given, Venugopal has given, Pawan Kumar is about to give a workshop. Farah is giving from Germany, and Dr. Kazadi is giving from Zimbabwe. A workshop of acupuncture converted to neurosurgery. And this is only what you can do. This is what the vision of my brother. I always express this thing that you people think and come out from your boundaries. Sophocles told a very beautiful word. Great is the human mind, and great are his thoughts. The higher and higher you can go, and you can conquer the moon and the skies and Mercury and the Jupiter, and the lower and lower you can go to the depth of the seas. It is the mind, the imagination. Sir told one very beautiful thing just before you completed. You should do such work that people laugh at you, and then you should sit silently and you should say, what they fool people. They don't know that they're laughing on themselves, not on you. This is what Nikunj also said me. They don't laugh at us, they laugh at themselves. And I am really blessed. The whole society is blessed that the entire generation, the legacy is today at one place. I never thought in a single day a legacy will be there in the one place. And people will see how spine surgery, brain surgeries. I know that most of the people might not even have seen the brain. And today, for the whole day, they are seeing the spine, they are doing the fixations, they are seeing the tumor evacuations, desiccations, large tumor being desiccated, and then they see the healthy prognosis. And I'm very thankful to you, Dr. Nikunj. We all will be in your touch, and every month this workshop will be with you, and you will be the chairman of this workshop. And I'm sure the legacy goes on, and the people will bring Rinasha, new reformations, new Rinasha. The 21st century will be far better than 20th century under your leadership. Thank you so much. We are really blessed with your presence. May we always be blessed with these events and organizations under your leadership. Thank you so much. God bless you all.
Thank you, Swamiji. Thank you, Swamiji. Very, very thank you for giving me this opportunity. And I'm very pleasure that I connected to this platform, to all the people, to all the physicians and all the physiotherapists who can listen to me and it can make complete use out of me by connecting to me. My number is there with Swamiji. And once as Swamiji always said, Dr. Nikunj, give me your visiting card, and always I say, I am in the process. So that I should be provide to Swamiji. And once again, my request, my thank you, humble request to Swamiji for giving me this opportunity to talk on this platform. Namaskar, Swamiji. Meet you soon.
Thank you, Dr. Sastry. Thank you, Dr. Nikunj. Thank you, everyone.
मेरा एक practical दिखाएगा how to recover this patient.
Sir, namaskar.
Now I'll teach you the live treatment from here. I don't know how the things are there. I'm not a technical person. You know, for my whole life, even this one, I don't know how to own. There's the biggest drawback of me. I don't know what is this. They gave me a gift, a patient. I call it Samdiji, gave me a gift today. I'm just putting in the neck and I don't know how to put it on. I'm just putting it here and I don't know how to own it. So you can understand I'm not a technical person. The technical team is very beautiful. Naman, Sunil, and Shivani. And medical team is led by Dr. Pati, Mir Ranmare, and I'm sure every month we will unite. We'll go for a better mission or a better purpose. ये जानिबे मंजिल तुझे पाने के लिए हम अकेले निकले थे लोग आते गए और कारवां बनता गया. Hi, M.K. Shastri, 20 years back, took one needle in my hand and I said, I'll recover paradises. This one needle, and today I tell you, in more than 20 countries of the world, my students are practicing this non-invasive brain stimulation. It is less practiced in India, but more practiced in the world. And every day, I tell you, by the name of M.K. Shastri, in Philippines, Zimbabwe, France, Germany, China, Italy, America, Scotland, Ireland, Latin American countries. Every day, per day, we see around 5,000 to 10,000 patients every day in the world with only NIBS. That is our achievement of 20 years. I always said I am one, but in India it is said, मैं एक था बहुत बनने की इच्छा था और फिर मैंने लिखा एकम सत्य बहुधा वदन्ति. I am the only truth and rest is my replications. And now these replications have become a evidence that every day when you see 10,000 patients in the world and every day you see recovery in more than 1,000 patients in the world, what do you say? It is scientific or non-scientific? You have to decide. I'm very happy that all of you are getting an opportunity to study in Italy, France, Germany. You have a chance to see neurosurgeries. You have a chance to see spine surgeries. And now you will see the live telecast of blogs with me, Dr. Vati, and other people. Our infrastructure is not very good. Very, very simple infrastructure with mobile phones will make you connected. I don't know how things will do, but I hope it will do in some way. You will be benefited. So we are going to the practicals, and then Dr. E. Gopal, then Dr. Karthik, then Dr. Abhilash, then Dr. Avinash. All will be giving their talks all of it. Yeah, chalo, ab to hum log kar dete hain. We'll give you, I will show you how I give the blocks. बाकी है
हम मैस नहीं करेंगे एक बार ताकि वो लाइव चलेगा ना।
हाँ तो आप लोग एक काम करो, अपने अपने मोबाइल में देख लो।
मोबाइल में हेलो
अपने मोबाइल में सबको अपना मोबाइल ऑन करो और देख लो, और मेरे ऊपर मत गिरो। ये लाइव करो, ये पेशेंट को लाइव लो, इसको लाइव लो। आज फाइनली द लैब स्टार्ट। नहीं, वो यूज नहीं करेगा, मैसेज दे देगा।
ये सर एक मिनट पकड़ना दीदी।
पति है, पति तो देखो क्या करे, इसको खाना दे दो।
बच्चे नाम लिया था।
International conference. 20 people of the country asking. You could see over there. Right? कुछ समझ में आ गया। बोले स्वामी जी, मेरा स्वामी जी को नहीं है। मेरा नाम क्या है?
आप एक उसके बात करो, बताओ।
ये मेरे पास कुछ नहीं है। मेरे पास केवल बस है। मैं वो केवल बस लगा के नीचे
नहीं पर अभी क्या है रीजंस ना भी।
अरे मैं चप्पल का मैं कोई नहीं मालूम।
जूम पे जाके या यूट्यूब पे एक बार उस पे कर लो, मैं तो ऑनलाइन कर दिया।
अब तो क्या आपने अपनी जगह पर कर दिया?
उसके आपको एक
आप लोग क्या करो मोबाइल
Imagination.
So you can say, one is about patient, if you are patient from AIDS, right? And you tell it, and you will tell it.
आवाज कम करो।
हो गया बोल दो ना
देखो हो गया हो गया नहीं
So you can see this patient is from AIMS, the picture, and is the patient of Dr. Shivani. The Dr. Shivani will tell what is the problem of the patient.
This is the case of CDG type 1A, chronic congenital
First, you
glycolysis.
introduce yourself. What is your name and qualification, and how many years of experience?
Myself, Dr. Shivani Malhotra. I am a physiotherapist by profession and having a 17 plus years of experience. And this is my case. This is the case of CDG type 1A,
CBG means what?
congenital glycosylation type 1A. The main problem is yes. And this is the reference case of the main parents are milestones. Now patient is 6 years old and he's not able to walk and having poor control over speech and increased concentration in everything. But after getting treatment from sir, I have seen vast changes in like 2-3 months. Now the control of tongue is very better. He's able to sit without support. And this is the
So, how many what is the person of the mother?
they are coming for last 2-3 months and
2-3 months. Okay.
no, 3 sessions in each workshop and hardly few seconds. And now mother will tell you what's their feedback. आप बताइए कैसा आप पहले से?
इधर देखिए मैं मोबाइल में देख रही है जोर से बोलिए क्या अच्छा हुआ पहले क्या था क्या अच्छा हुआ now you kids on the cover. So you could see by putting it over here I recovered his quintile and the various contractures we have recovered. So today you will see how I use all prolotherapy to break the spasticity and to break the contractures. I'm sorry, my neck is not good. I've done a lot of adventure with my neck. But I'm sure this neck will support me for next 48 hours. So my neck has gone down, but my spirits are high. And we will see how you will work. Simple, there is no infrastructure here, you see. And there is small dry needle. But this dry needle, as IP check, when you work, people should laugh. And when they laugh, you should smile. And then they say, what a fool. A case which could be recovered in days, 6 years. Now who should laugh? I or you. You think this needle is no work, but if you see the Bible and if you read Quran, if you have faith in this needle, it will make a miracle. My small faith in the needle has made miracle. And I'm working right now in 20 countries of the world. Every day I attend around 6 countries from the WhatsApp. And I've been training all types of people. And I'm going to New Zealand and Zimbabwe to train one of the most pioneer surgeons of South Africa, Dr. Kazadi, in this NIBS. And now you will see Dr. IP is also getting trained. And now IP is so interested that now there is a paradigm shift. We are going to 5 level up. And now neurosurgeons are practicing this. Now you cannot be questioned. Orthopedic surgeons are practicing. Mihir is practicing. Neuroanesthesiologist is practicing. Karthik is practicing. Avinash is practicing. All the great people of the world are practicing. Right? Now, after some time, you cannot question what is this. Now you see how beautifully I do the mapping of the brain. And you see, since everything is known to me, I just keep on putting needles. 1, 2, Three. And my job is done. Topic over. This is only the treatment I do. And you will see some changes by tomorrow. So after 2 hours, we'll find some changes in the patient. सुबह मैंने जो needle लगाया, अब उसका changes आपको 2 घंटे के अंदर we'll see a genetic case where the chances of recovery is very minimum. You can see the changes on the table. So it's not like you treat a patient in the morning and you see the changes after 20 days. I think I'm in the right way. Let me get the question. Thank you so much. Finally, my neck is saying I'm not going to retire. The neck was thinking, Nastini, you have to retire. I said, no, I got my wife. Whenever the husband is sick, the wife comes in support. So when I was not able to be sick, since I got married, I'm married to many gadgets. So one of my gadgets is this. The new gadget of my family is this. By evening, I will tell you how I know how to use this. I have a neuroplasticity of this gadget. So this is a new gadget. I don't know how to use it. I'm putting in my name so that you know that I'm a new person of gadget. But by evening, you will know that I have a neuroplastic changes in my brain. And I'm having one additional skill in my life by evening. I know neuroplasticity of this device. What do you call this device? Huh? Take back. And you need it for what purpose? The result that comes from this. So you don't have to take cost from this. So I don't have to put my mobile over here. This is very easy. Oh, I can go like this. Then I can put patients. And then I talk. Oh, I'm in the new world. I never know this. I only know what you know. Putting the mobile like this. Yeah, I know only like this.
Now you are heard.
So I really laugh at myself. What made me stop? Like this. From the idea I'm struggling to get rid of this mobile phone. And you see, it takes too long. And I know this is the exist in the world. It's really beautiful. I only know one thing I can discover. And I'm so dedicated to these leaders. Whenever I see anything about leaders. And I really see. Because of my one determination, I'm modified more than 5 lakhs of millions of the world. Is a population. In last year, you see, I am one population of the country. If you go to the Luxembourg and all, and the population is 25 lakhs. So if I have 5 lakh patients, and 5 lakh people, so many members, how much? And then their relatives. So you take one member, and it's I'm associated with and that is why I say I just go with this ground, and I come this, and I get the respect. And what is my respect? I'm the only person who said I have access to the brain. I have access to neurological disorders, and I rectify. I use it with neuromodulation device. This is neuromodulation device. I can do neuromodulation in the brain. I can do ablation. Video frequency ablation with the help of this device. क्या आपके एप्लीकेशन होनी चाहिए So here are we there? So those who want to go, you go. But those who are going, will not give them a certificate. And be careful. If you don't attend your night class, no certificates. Whether you are on Zoom or whether you are here. And if you don't come on time, people do not come on time. So Third, they came at 12 o'clock, 1 o'clock. Is it my homework? If you don't know the meaning of punctuality, don't come to education. You are treating the most serious patient and you don't know what to do tomorrow. Or you are complaining. That's it. You were a spinal cord injury. But you have come too late. You have missed the talk of height changing. You have missed so many good things. And
सर सारे लेक्चर ऑनलाइन करे हैं मैंने
अब ऑनलाइन करने से क्या हुआ? आपका इंटरेक्शन हुआ उनके साथ, आपकी बातचीत हुई। ऑनलाइन तो सब कुछ होता है। ऑनलाइन आप शादी भी कर लो, ऑनलाइन बच्चे भी पैदा कर लो। आईवीएफ ऑनलाइन नहीं होता बेटा, वो प्रैक्टिकल अप्रोच है।
सर ये करता है ये ऑनलाइन
If you would have stayed with us yesterday, no. If you would have stayed with us yesterday, I would have showed you below 1 second we can recover the patient. Below 1 second. The orthopedic surgeon was here, and you are with me at 3 o'clock. Yes, our class completed at 5, 6 o'clock in the morning.
नहीं सर 3 बजे देखा
तुमको क्या लगता है सोने के लिए आए हैं यहाँ? You know why you people are so skeptical? Because you don't have the pain of the society. You are just now. And when I take the load of the society, the pain in my hand. I never consider it as your patient. I consider it as my relative. And when I test the patient, I want result on the table. And all these patients whom you have seen yesterday will see results today on the table. But you bad luck will never done the same because I completed. आपने रात में क्यों नहीं पढ़ाई किया? चले गए तो आपने वो नॉलेज भी मिस किया। लेट आने के कारण अपने न्यूरो सर्जरी का सर्टिफिकेट भी मिस किया। आपने रिसर्च की ग्रोथ भी मिस की। Always say the better. The second one was missed. Because one was half an hour. आपने करेगा, सबको करेगा। डॉक्टर बाकी है, आगे नहीं है ना? ठीक है, बैठ जाइए। बैठ जाइए। give me block. पैसा मिला दो। एक 100 ml में दोनों मिला दो। इनको क्या हुआ? 8 साल पहले। So here you can see this is a transaction case injury. That's why you. You can see them, right?
पांच के रखते हैं ज्यादा बेटर रहेगा से फूल आ रहा है
एक युवक से जब खरीदो ना तुम्हारी बात ना करेंगे लगा देगा कहीं तो ठोक देगा
सर सारे पूरा पास है
here you can see there is a translation theory of the patient and the fixation has been done and here you can see the injury of the core और एक है वहाँ
आप लोग स्क्रीन पे देखिए ज्यादा क्या आएगा
here you can see the transaction injury and here you can see the injury of the core so this is the post fixation. This is a post fixation case and the patient is from last 8 years on the wheelchair. So we will see how much we can recover the patient.
सर एक बार फिर से बता दो.
Here आप देखिए 2, 3, 4, 5 and 6. So there is a major injury in the 6th level. So this is 2, this is 3, 4, 5, 6, 7. So 5 and 6 you can see that the fixation has been done. And here you can see is the transaction injury. So you can see myelopathic changes also there. You can see the edema of the cord. And here you can see the transaction. After you do the stitches of the cord, you put the stitches in the cord, but still they remain in the cells. So this is the extension of the cord in the brain. You can see the cord is extended in the brain, and there is the disruption of signals. As a result, the patient is quadriplegic since 6 years. Now, in the growing time, his proximal and distal muscles, the near and the external muscles have started working. And right now you can see a beautiful shift in the patient. You will see what we can do in just 2 days.
Yes.
So you can see the elongated case, and then you can see the connecting rods, and then you can see 1, 2, 3, 4, 5, 6 pedicle screws in this patient. It's a case of road traffic accident. You can see 6 pedicle screw with connecting rod and elongated case. So now is the spine is stable, but we have to recover is the core. So here you can see a very clear image in the transaction in the injuries. So this is called a transaction spinal cord injury. ये तो transaction बोलते हैं इसको. तो क्या बोलते हैं? Complete. इंटरनेशनल स्केल है, ASIS का स्केल है, grade 1 scale है ये. It's complete injury. Here you can see. Now, can you think this patient can recover? I will say yes, he can recover. What makes him recover not for 8 years? It's just a 3-month case. Okay, January. So this person was injured.
दोनों 2016 का 2016 का सर ये.
So he is a case of 2016 now.
जल्दी जाओ.
Patient was well. आज इनकी वर्षगांठ है. Spinal cord injury की वर्षगांठ है.
Happy birthday.
वन एम्पुल
हाँ.
वन एम्पुल
एक एम्पुल बस 10 ml मार दो.
वन नहीं
एक में दोनों मिला दो. So here you can see he was sudden onset of non-progressive severe intensity, sharp in character, aggravated by movements partially relieved by rest, and associated with inability to move all 4 limbs. He also lost his bladder bowel control. He now came to Indian Spinal Injury Center for further management. No issue of lost consciousness, vomiting, and ENT bleed. So it's around 2016 blood test. EOC. I think they made a mistake. He was evaluated by a team of spine surgeons and was diagnosed by a case of irreducible biofacet disassociation of C5C6 and C4-C5, OPBLL injury with complete spinal cord injury. So I said you, it was complete spinal cord injury, wherein ACDF procedure was followed and posterior reduction was done at C4-C6 level. So you can see ACDF was done and mass fixation was done in 3 stages. Postoperatively was shifted to ICU and clot observation vital monitoring was done in pure cough relax. All these things were there in 10 years back, and then later on you were discharged. So overall, if you come to know, the dermatome is C60, C70, C80, T10. Lower limb 0/5. and in all muscle groups. The ventral is mute, sensory is absent, tear, bilateral knee jerk and ankle jerk absent, back absent, back absent. So you see, another challenging case has come to me. So if you tell Sanjay when it's your exam, I say every day. You think all people I get up in the morning and then I say, what is it from Malaysia, from Italy? You see, I don't know. Then I really enjoy all of this. I say, how I work with, I know from. So we will give all the blocks, stuff like this, and I'll give all the blocks today. I get the body. ब्लॉक करेंगे निकल मारेंगे अब क्या बोलते बड़ा बोलते बड़ा समझे जी लगे अब सब्जी के हमारे साथ क्या बात है जो खाना चक्के खाओ हरियाणा के खाओ हरियाणा आए हो तो खा पी के
नमन नमन जी आप अपने आप को म्यूट कर दीजिए ताकि सर अच्छे से देख पा रहे हैं सभी को।
पाटे हो हफ्ते वोट डालेंगे और करेंगे लोग मारेंगे करेंगे वो भी आ रहा है वो भी हम वही बनाएंगे यही डालेंगे नाम लिखा जाता है अभी जाने के गया ना तो मैं रात को थोड़ा करेगा
नमन मल्होत्रा जी आप अपने आप को म्यूट कर दीजिए ताकि सर की क्लास सभी को अच्छे से देख सके।
इसके बाद
नमन मल्होत्रा जी आप अपने आप को म्यूट कर दीजिए, आप बीच में आ रहे हैं स्क्रीन के ऊपर, किसी को कुछ नहीं दिख रहा।
और पूरा कोशिश कर रहा है
नमन मल्होत्रा जी आप अपने आप को म्यूट करिए।
हरियाणा गाँव से गए हरियाणा की मिट्टी में लग रहा है, हरियाणा के खाने पीने में। ये मदीना गाँव है हमारा। तो आपको बारात में बुलाएंगे ना।
तीन की है
हाँ, तीसरी और एक बच्चे की, दो बच्चे की।
डेट तो सके हुए हैं
एक दो बच्चा है, एक तो सोलह का था, फिर वो बच्चा था। सबसे अच्छा होता है उनको हरियाणा में, किसी का भी बच्चा है, कोई भी हरियाणा। चलो कबड्डी को एक दिन कबड्डी की। So you see, I don't know the basis of the race, right? Race from this. अब तो सेकंड है। अरे इतने मौके मिले बाबा, यूनी ने रेस नहीं हो गए तो इधर अपना मैं बोल रहा था। This is a very good case. अच्छा case. अब इसको ना हैदराबाद में क्या हम लोग स्टेंसिल थेरेपी सब करेंगे। We'll see that we can improve his life to some extent.
कितना टाइम लगेगा
2 महीने तो देख
Please
लेगा।
please refer from Dr. Sunny Gaba, one of my team.
ये मतलब तो पाना है। ये लोगों को भी खाना है।
अच्छा आपका
ये देखो। पर और नहीं यहाँ।
उधर सर उधर सामने भी
चलिए।
हाँ
कहाँ गया तो ये? इसने किया। हाँ?
पर हो रहा
ईश्वर बोला। चलिए। चलिए।
पानी दे दो सर को पानी
Intelligence CPN ना करना ये ना बेटा। दिखाओ। पार्टी को बुला लेना।
भी ऑपरेशन बताया वहाँ पे एम्स में
So here you can see another case of OPLL myelopathy at C5C6 level is having OPLL, ossification of the posterior ligamental flavum.
फिलाडेल्फिया
So Philadelphia collar is given. Yeah. So it is a hard collar.
यस
So they,
अभी तो सर साइटिका है बहुत ज्यादा
ठीक है। हाँ, अभी आपका sciatica का pain you will subside by 50-70%. Very good, right?
एक दो दिन में 75% खत्म हो जाएगा तो सब मुझे एवरी मंथ आना पड़ेगा
हाँ ये मतलब पैसा चार्ज करते नहीं।
अच्छा कितने दिन के लिए आता है फर्स्ट टाइम आया हूँ
इनको ये हमारे कोऑर्डिनेटर सरपंच सरपंच जी से बात कर लीजिए। ये हमारे संदीप
पहले मिला था ये लोग बाहर बैठे थे इसकी परमिशन लेके लगाया उसको मिलने
ये हमारे संदीप ये हमारा अरे हमारे सरपंच जी क्या आप बैठिए ब्लॉग्स रेडी हुआ
ये सर इधर
मैं इसलिए तो बार दोबारा पूछ के आया आपने अब इसको 100 ml और इसमें दोनों 2 ml वो है सही से करेंगे तो तो डॉक्टर नमन वो हैं भी दे रहे हैं आपको नंबर देंगे ना फोन नंबर निकालिए फोन नहीं होगा इससे घंटी मारना एक बार ये चल रहा लाइव चल रहा है ये वो खुद ही दे देंगे हाँ ये लाइव चल रहा है ना
अच्छा जो क्या ब्लॉक्स का देना ब्लॉक्स का देना ब्लॉक्स फॉरवर्ड करना ब्लॉक्स का
उनसे बोलना मुझे नहीं पता तुम पकड़ा दिए फोन
अच्छा उसमें है
नंबर में दे दूंगा नमन का ठीक मैं अभी दे दे रहा हूँ ठीक है आपके पास हाँ है नॉर्मल सलाइन 100 ml की मंगवा दो 3 अच्छा ये 3 लेके आना इसकी फोटो खींच लो 100 ml की लानी है ये 500 100 ml की 3